Hi, everyone. Welcome back to the show. In the middle of June 2022, the government finalized a strategy paper that sets out incredibly ambitious plans to harness data in the health and care system in England. They called the strategy paper, the strategy they're going after, Data Saves Lives, which I completely love. Obviously because of the power that data has, and in the context of health and care for individuals, of course, it does therefore have the power to save lives if we get things right. The strategy sets out by Sajid Javid, the Secretary of State for Health and Social Care, the vision for how data will be used to improve the health and care of the population, and importantly, in a safe, trusted, and transparent way. And I'll come back to that. The paper was published in draft format in June 2021, so about a year before the final paper was published. And the aim there was to enable full and open engagement with the general public to ensure that people that were going to be impacted by the strategy were, of course, able to contribute and provide feedback on it. And then that feedback informed the final version that was recently published. So that engagement, I think, was good, and it was the right thing to do. And obviously the paper that comes out of that, therefore, has been informed by, as I say, those that are impacted by it. Now, as someone in the data industry, and of course, as a citizen of England, this strategy is one of the most exciting, interesting, and potentially impactful data strategies that there are around. If you think about sort of the health and care system and what it's using, this data strategy is picking on one of the most precious pieces of personal data, or precious sets of personal data that there is, which of course comes with challenges for those that are in charge of it, but also a massive upside in terms of the impact it can have on the National Health Service, all its stakeholders, and of course the health and well-being of the population in England. And with the devolved decision making that exists in the United Kingdom, this will hopefully provide a steer, a platform, a starting point at least for other health systems around the country, and other governments around the country to pick up on. Of course, maybe it sets the standard that people can look at around the world as well. So the use of NHS data more recently was put at the center of how the United Kingdom fought against, and has been fighting against, the COVID-19 virus and the pandemic that created. And of course, it helped to get help and support to those most vulnerable, and also help the rest of the population get back to some kind of path of normality. And Sajid Javid has stated that we need to keep the momentum moving forward and use the learnings and approaches used in those recent times to tackle, of course, the short-term challenges that we have, but mid and long-term challenges for moving health and social care forward, and to tackle the backlog of support that's required by people that was created during the pandemic, and get back on top of those challenges. So this Data Saves Lives strategy supports four main health reform priorities: prevention, personalization, performance, and people. And Sajid Javid has said that they won't be able to deliver the change needed against those health reforms and the plans around conditions like cancer and dementia and mental health that are top of the agenda, unless data-guided decision-making is embedded in that change, and that digital and data technologies are much more fully embraced and embedded in how the health system operates. So real nice alignment and link between the reform priorities in the sort of the governmental and policy and strategy for the health and care system to the data strategy that they're putting in place. Now, it's not clear what the paper calls these things, but it lays out 7 what I think are commitments or aims or vision statements that form the basis of the Data Saves Lives strategy. So the first is improving trust in the health and care system's use of data, so that the public have confidence in how their data will be handled, and happy that their data will be used to improve the care of themselves and those that others received. Now, that trust needs to be earned clearly, and it will be really interesting to see how the public are educated, engaged on this one, and hopefully asked to opt in and given the opportunity to opt out of how their personal data is used. But this concept, this need to ensure that there is strong trust in what's going to happen with data and in how our data will be used is at the center, and it's number one in the commitments that this strategy paper lays out. The second is giving health and care professionals the best information they need to provide the best possible care. Now, the vision here is simple. They want staff to have easy access to the right information to provide the best possible care. That sounds really straightforward, sounds really simple, but from my experience, this is really challenging to achieve for all sorts of reasons around technology, around data access, around sharing, around education, around fluency or literacy in data, around a culture of wanting to and being able to use data for decision making, and rolling this out on such a large scale across the National Health Service and across the population of England will be really interesting to see how that pans out. Now, the third is improving data for adult social care. So really zooming into the social care and then zooming further into adult social care. They want members of the public and their care teams to have access to timely, high quality data to improve care quality and inform the choices about their care and their support. Really important. Number 4 is supporting local and national decision makers with data. Of course, at the heart of any good, strong data strategy is that it supports decision making. So leaders and policymakers in every community will have up-to-date, this is their vision, sophisticated data to make effective decisions and help the health and care system run at its best. Again, simple to say, quite challenging to implement. Number 5 is empowering researchers with the data they need to develop life-changing treatments, to develop diagnostics, to develop models of care and insights that researchers are able to safely and easily access the right data so that they can therefore create innovative solutions to benefit everyone. And then sort of similar to that, number 6 is working with partners to develop innovations that improve health and care. And what they're looking to achieve here is that they give innovators the support they need to develop and deliver new solutions quickly and safely and get them into the system when they're proven to be successful. Now, the final, number 7th, is developing the right technical infrastructure. So none of the things we've talked about before or at all yet really have been about technology. But all the other commitments that I've mentioned and that are in this paper are, of course, underpinned and underlined by a strong data architecture that helps make more effective and efficient use of data. So that includes things like modernization. There's lots of legacy platforms, legacy technology. You hear a lot about this in the press, about the challenges sort of on the front line with archaic and legacy systems and technology. Applying modern data architecture principles. The world has moved on. The way we access, integrate, move data around, structure data has changed, and the technology that exists now enables us to do different things. Investing in cloud technology. Of course, that's a much faster, more effective, and potentially cost-effective way of storing and accessing data and getting it to the right people. And then massively improved integration. So with the move towards APIs and better data sharing, the integration between systems, the integration between departments, the integration between organizations will be fundamental to getting this right. All, of course, while staying ahead of the changing and challenging cyber and fraud risk that's kind of ever present. So each of these commitments they show in this paper is already in flight. They have done some work already. Progress has been made already over the last couple of years. This isn't a standing start. This is an evolution, an iteration of what's already gone before it. Some more than others have made sort of more progress than others, but what is clear is that there is absolutely loads to do against each of these, and each one requires government to work within a load of constraints that will make the implementation and execution of these really challenging. And I think there's some really bold and brave yet impactful commitments being made here. I think it's super exciting to see the focus on outcomes to all stakeholders of the system, the policymakers, leadership, frontline staff, and of course those that need care and the citizens that interact with the healthcare system. They do lay out some timelines against each of the commitments. So each of those commitments that I mentioned, the 7, has a set of milestones that some of which have been delivered and started in 2021. Some are being delivered this year in 2022, and then they run through iteratively delivering elements of those commitments until all the way through till 2025. So it's only kind of a 3-year strategy. I think very, very ambitious. Will certainly require, and I couldn't find sort of the investment figures here, but will certainly require hundreds, if not billions, of pounds worth of investment to design and implement these changes. But again, the upside will be so great if we get this right. And I'm really pleased that the government is being so digital and so data guided in its approach to what is really a critical, baseline quality of life system, the health and social care system that we have in England and the United Kingdom. So really insightful piece. You can go to gov.uk to read about this more. There's much more in the press, as at time of recording in sort of middle of June about this paper. I can't wait to see what happens with it. I hope you enjoyed me unpicking this new strategy. I hope it informs some of your thinking about how you do your data strategy. And indeed, if you're in a country outside of England, maybe there's some lessons to be learned and that you can take into your health systems, into your data strategies that you're putting in place. So hope you enjoyed the show. We'll catch you again soon.